Hi, my name is Meaghan Howe. I'm a family nurse practitioner, and here at Gold Direct Care, we strive to provide 5-star care without the constraints of working within a broken healthcare system. So I always knew that I wanted to go into the medical field. Both my parents are medical, so just growing up, it was second nature to me. I really found that nursing was a better calling for me. So I applied to nursing schools and fell in love with the profession. I just found that I was able to spend so much time with patients and really make a difference in their lives. But I wasn't really able to call the shots in patients' healthcare. I was just stuck within the constraints of my nursing license at the time. So I went back to school, got my nurse practitioner in primary care so that I could provide a little more guidance to patients and be more a proactive force in their healthcare. Throughout my experience as a nurse and working in primary care, I started to see how there are a lot of barriers. So while I was in nurse practitioner school, I was also working as a registered nurse in primary care. And I was really seeing that providers did not have enough time to spend with their patients. They weren't able to do the things that they wanted to do. In my clinical rotations, I was really frustrated that I was only able to meet with patients at about 15-minute intervals and was not able to spend the time educating, diving into all their different health issues. So that was really frustrating to me, and I didn't really know that there was an avenue that I could help patients outside of this broken system until I met Dr. Gold. When I was in school, I actually ended up doing a rotation with Dr. Gold, and that's when I first learned about direct primary care. One of my first days in the clinic, I was able to spend about 2.5 hours with a patient who was really having a tough time, and even in that visit, I could see a difference in this patient from start to finish. So that's when I really had my first introduction to direct primary care and how it can help patients immediately without all the constraints that we're held to within the healthcare system. Dr. Gold brought me on to the practice in October of 2021 to hopefully allow more female patients in the area to feel more comfortable coming to our practice, seeing me as a female provider where I'm able to talk to them about anything specific to women's health needs and get them any kind of screening exams, lab tests, physical exams that they would like to be followed on a regular basis, and I'm here to help them with that. So to anyone who might think that our services are too expensive or why would they pay for primary care when they can get primary care for free within their health insurance plan, a couple weeks ago, a patient came into our clinic with a dog bite on his face. Dr. Gold was able to see him immediately, provide the antibiotic prescription that he needs, clean out the wound effectively, and stitch up the laceration on his nose with sutures in clinic, saving that patient likely at least $1,500 from an emergency room visit, a lot of time spent in a waiting room, and likely a lot of headaches dealing with his insurance company about claims and deductible pricing. So there's several cases like this where we're able to help patients on an individual basis. We would never turn a patient away or cherry pick patients based on their health conditions. In fact, a lot of our patients who come to us are patients who are feeling like they were chewed up and spit out by the healthcare system because they weren't getting their needs met and weren't able to have that time spent with a provider to really figure out what's going on with them. So if you're interested in what we're talking about and want to learn a little bit more about direct primary care, you can visit our website at www.golddirectcare.com, or you can email me personally at meaghan@golddirectcare.com and let me know if you're wanting to set up a free consultation so we can talk a little bit more about direct primary care and any questions that you might have.